tienes 15 minutos, tienes tiempo para mejorar tu vida espiritual. En Búsqueda Interior encontrarás un espacio de calma y paz, de total aceptación, para que nutras tu alma. Porque en este mundo cada vez más espiritual y menos religioso, siempre ayuda. Vamos a entender juntos qué significa la vida, el amor, la justicia y el alma. Yo soy Mauricio Sánchez Scott y te invito a Búsqueda Interior.
When your gut feels off, your whole day can feel off. Activia probiotic yogurts and dailies are a quick, easy, and tasty way to up your gut health game every day. They're deliciously smooth and creamy and packed with billions of live and active probiotics. Your gut is where it all begins, so start with Activia. Enjoying Activia twice a day for 2 weeks as part of a balanced diet and healthy lifestyle can help reduce the frequency of minor digestive discomfort.
This holiday season, design your dreams and discover the wide range of iconic Ralph Lauren fragrances to enchant your friends and family. Featuring the bold Polo 67 or the energizing Polo Red. Discover a wide selection of Ralph Lauren fragrances gift sets and look out for a complimentary duffel bag at your local Macy's or on Macy's.com. The fragrance destination. Purchase needed. See details in stores. Select doors only while stock lasts.
Esta es una producción de Marta de Baile.
Lourdes Botello, experta en comunicación y storytelling, comparte hacks que puedes aplicar desde hoy para desarrollar tu talento único y vivir tu vida de la mejor forma. Sumérgete en el pensamiento crítico para crecer en todas las áreas de tu ser y pasarla bien en el proceso. Esto es Talento para la Vida.
¿Te has obsesionado por acomodar las latas de la cocina, todas con la etiqueta viendo para enfrente, todas perfectamente limpias? ¿O tienes a alguien en tu familia que no puede salir sin los cajones no están perfectamente acomodados o sin revisar 3 o 4 veces que la estufa esté apagada? Eso es lo que todos podemos identificar con un trastorno obsesivo-compulsivo, y a veces hasta le hacemos bromas, a veces hasta lo usamos para reírnos o para describirnos a nosotros mismos cuando tenemos una característica que nos parece simpática, pero obsesiva, pero medio necia. Pero la verdad es que profundizando en el trastorno obsesivo-compulsivo vamos a descubrir que es mucho más que eso, que puede ser algo muy doloroso, algo que se roba la vida de los seres humanos, y además es una condición que tienen entre el 2 y el 3% de todos los seres humanos que habitamos este planeta. Por eso hoy vamos a hablar del trastorno obsesivo-compulsivo con una de las más grandes expertas en el mundo sobre el tema. Ella es la doctora Lynne Drummond, que es psiquiatra investigadora reconocida a nivel internacional y ha ayudado a personas con TOC o trastorno obsesivo-compulsivo por más de 40 años. Ella trabaja en Londres, es psiquiatra consultora honoraria en el Southwest London and St. George's NHS Trust y es profesora visitante de la School of Life and Medical Sciences de la Universidad de Hertfordshire. Además de ser doctora y profesora, Lynne trabaja en varias organizaciones que ofrecen apoyo a pacientes con TOC y a sus familias, como Triumph Over OCD y Phobias UK, OCD Addiction y OCD OK. Y ha publicado varios libros, muchos de ellos clínicos, pero hoy estamos aquí porque está recientemente publicada la versión en español de su libro para público en general que se llama Todo lo que necesitas saber sobre el OCD o Everything You Need to Know About OCD, un título que se publicó por Cambridge University Press, que ya lleva 4 ediciones y que por fin está en español. Lynne, it's such an honor to have you. Welcome to the program.
Thank you for inviting me.
So we were talking just before we started about 3 very important messages you need people to understand about OCD.
Yes. The first thing is that OCD is not a minor thing. It's not just being neat and tidy or being careful. It's not a quirk. It is actually a serious condition. And it's a very serious condition. I will talk more about it in a minute, but it consists of extremely distressing thoughts, images, or impulses, and then some behaviours that are designed to reduce or prevent the harm. That can lead to people getting into very severe states, having other mental health problems and physical problems. And actually, sadly, some people do die due to OCD or TOC.
Yes.
However, The good news is that it responds extremely well to the right treatment. Sometimes people don't get the right treatment, and that is one of the reasons why I want to talk and spread the message so that people with TOC or OCD can know what they should be looking for.
Sometimes, as we've seen in many other disorders, for example, in depression, there is a statistic that says that it might take up to 2 or 4 years to be diagnosed correctly. Is that the case with OCD?
I think, sadly, it's even longer.
Longer.
In my clinics, it's often been 20 years.
Oh, my.
And, this is
It's a
very,
whole
very
lifetime.
sad. One of the problems is that when I started out being interested in OCD, way back 40 years ago, I used to be invited to go and talk on radio or television, and the people would talk about obsessive-compulsive disorder, and nobody knew what it is. So we've got better than that now.
Yes.
People do talk about it now, but sadly, when they talk about it, they are making out that it's a minor thing, like being fussy.
Yes.
And of course, people with OCD, they have insight, and so they know why that what they're doing isn't right. And they often are very, very reluctant to come forward and to seek help. And even when they do, often it's not recognised, even by professionals. Because people with OCD, certainly when they've had it for a time, often are also depressed.
Right.
And so people will see the depression and ignore the OCD. But yet the OCD really needs to be treated, because otherwise you're not going to really solve the problem with depression.
Treating the depression is not going to solve
the underlying condition.
Right.
Absolutely.
So what would be some OCD thoughts or ideas that people have that make them repeat actions or create these even superstition rituals or attitudes that that interfere with their lives?
I think the word superstition sometimes can apply to a lot of this. It's a good word.
Yeah.
As I say, obsessions are horrible, nasty, intrusive thoughts, images or impulses.
About catastrophic
about
things,
horrible
consequences.
things. The important thing is that they cause you to be distressed and anxious.
Okay.
And because you can't run away from something that's in your mind, you then design a number of behaviours or thoughts which are designed to reduce or prevent the anxiety or distress caused by the obsessive thought. However, either they're not realistically connected or they're clearly excessive. So, for example, the one that people often think about is if you're worried about being contaminated by dirt or germs, you'll then go and wash. But you'll wash in a certain way, according to certain rules that you set yourself. Because high anxiety is horrible, when you have these thoughts, you feel very anxious, very distressed, as I say. That's unpleasant. When you do the compulsion, the behaviour to undo that, you feel a bit better. So that's almost like rewarding the behaviour before. So what that happens, it feed it. Yes, the more you reward a behaviour, the more it happens. The types of obsessions people have can vary from things like contamination, or else you may be fearful that you haven't done something, like lock the door, switch off the gas, and you imagine some catastrophe and happening due to that. Sometimes you're fearful that you have done something and that you may have committed some horrible act, and you may have an image of that in your mind. So you may have the horrible thought that you've been violent towards someone, even your children, whereas of course that's not the case, and that's very sad because you may move away from them. And sometimes even people have the thought wrongly that they may have sexually interfered with the child, and that gets everybody very concerned. Whereas in fact, of course, because it's so horrible to them,
but they believe it.
They start to take precautions. They know deep down. And then everybody else starts to wonder. Yes. And in fact, of course, they're the safest people in the world.
But they feel they might
have done. Yes.
Okay.
Then other things are loss of objects. People worry excessively about loss of objects. And that can even take the form of being worried about losing part of your body. I've seen people that check that they haven't dropped, and they know it's madness, but they still worry that their fingers have dropped off or something like this. Then some people have perfectionism.
Yes.
And that also goes very much, can sometimes go with autism. There's overlaps here as well.
I guess causes a huge amount of frustration, because there's no way Nobody's can achieve perfection. Yes.
Perfection is not a human state. And if you try to be perfect, you end up being exactly the opposite. Yes. Because I don't know what the word is in Spanish, but we always would say that somebody flies by the seat of their pants. So in other words, takes a chance.
Yes.
You want to be okay, you don't want to be perfect.
Of course. We say la perfección no opera, which means something like perfection is not operational.
Yeah. You can't. It
doesn't work. Yeah, it doesn't work.
Nobody's
like
perfect. Thank goodness. I think
we're
perfect
here
people.
To learn. If we were perfect, there would be nothing else to do.
And actually, wouldn't they be boring people if they were perfect? I think we love each other because of our flaws, not in spite of them. So those are some of the main themes that you get in TOC
something
or
that
OCD.
I really appreciated in the book is that you provide case studies, you provide examples, real stories of people that have lived with OCD. Can you share some of those with us? It might make
goodness, yes. I mean, there's so many of them.
Yeah, and especially for these kinds of OCDs that are not the typical or what people would go straight into thinking this is an OCD behavior. People, in the pandemic, people began being frantic about using alcohol gel in their hands or washing their hands. But there's many other OCD behaviors that might not be so evident at first.
Yes. And I'm going to say, first of all, that obviously, and in the book as well, it's not that these aren't true stories. They're all true, but they're not individual people.
Of course.
So you couldn't look at somebody and say, oh, I know who that is, because it's not true.
Of course.
But, for example, I mentioned somebody that was very fearful of losing part of their body.
Yes.
And this was somebody that went out and was very successful in what they did in life. But they would worry about losing things to such an extent that he began to even store his feces, waste products. And I've read about that. And we actually ended up with, when we got into his house, he had a bath full of feces.
Oh my.
And if you can imagine, he was a clever, intelligent person.
That knew
this was so wrong.
And couldn't stop.
But he couldn't stop himself. And he was so humiliated and so miserable about living in that way. Yeah. The good news is we got him better.
Right.
And this was after many years. So there's one example. Other ones that are a bit more, people don't always think about it, are sometimes people will worry, as I said, about things like I might, if I had OCD and I had thoughts that I might have attacked you.
Yes.
And I could do one of two things to reduce my anxiety. I could say, did I just hit you?
Oh.
And you would say, no. And so I'd feel a little bit better. Are you absolutely sure? You say yes. Are you sure when I came past you then that I didn't hit you? And so it goes on. That's reassurance seeking, but it also works like a compulsion.
Oh, wow.
The other thing I might do is I might need to go back through in my mind and play almost like a film in my mind of all my actions and what I was thinking about. And to do that, I might get completely stuck, and you'll see me standing completely still as I go through everything in my mind. Of course, that's just 2 examples.
Right.
It might be that you don't feel the need to do that at all. You might instead have good numbers and bad numbers, or you might have to do
the cracks in the sidewalk, or
you might have a behaviour that you need to do until it feels just right. So there's a lot of things that you can do, but though it's not all about cleaning and being tidy at all.
Right.
Indeed, actually, when it comes to even people that are perfectionist and want to, for example, have a perfectly clean house, I've been to people's houses that have that thought, and because perfection is just so unachievable, you will go in and there's a quivering wreck sitting in a bed with a house that is covered with mess.
Oh, okay.
Absolutely covered with mess, because it's so overwhelming. And it's this almost all or none thing. So once, say, you've got a coffee cup out of place, it's not perfect. And because they're so exhausted, then you've got 3 coffee cups out of place, and then everything snowballs.
Yes. And how about hoarding? Would
Hoarding.
that be obsessive-compulsive?
It can be.
It can be.
I've just actually written a book that's coming out in April that's called Everything You Need to Know About Hoarding in English.
I didn't know that. Look at that.
And there's a lot of reasons.
But it's such an interesting...
A lot of reasons for hoarding. But hoarding and obsessive-compulsive disorder can go hand in hand. There are people with hoarding that don't have obsessive-compulsive disorder, and there are people with obsessive-compulsive disorder that don't have hoarding. So they overlap. Hoarding is one of what we call the obsessive-compulsive and related disorders.
Okay.
So that includes obsessive-compulsive disorder, body dysmorphic disorder, hoarding disorder, Tourette's syndrome, and they're all health anxiety, hypochondriasis. They're all part of the same overall category.
Okay.
So they do overlap. Oh, and as well as that, the skin picking and hair pulling and all of those things. Hoarding is quite interesting because certainly in the UK, we think it's about 5% of the population.
Oh, it's a high number.
It is a high number, whereas OCD is between 1 and 3%, which is high enough.
Yes.
And they're not getting treated. Hardly any hoarders get proper treatment. And it's hugely stigmatised.
Hugely. I mean, people are so...
They see them as dirty, unpleasant people. And these are not dirty, unpleasant people. They're people that have a problem.
Lack of self-discipline. I think that's what might be. They judge very harshly.
Yes.
Even OCD, people with OCD or hoarding.
The stigma, we need to break down this stigma.
Yes.
I can say, I have high blood pressure.
Yeah.
Nobody turns around and says, well, snap out of it, get over it.
Or you know what, don't take the medicine, just, put your mind to it. You can make it out of high blood pressure.
Absolutely.
Like they say with depression, anxiety,
that.
or any other mental disorder.
So why would we do this?
Yes.
What's it
I
about?
agree.
It's crazy.
Yes, I agree completely. And we were talking in relation to that men eating disorders might be related or have a component with OCD as well.
Yeah, people often talk about this. We looked about, I can't remember the exact date now, we published this, I think it was about 2013. And we took a group of people with OCD and a group of people with anxiety disorders.
Yes.
And we looked for features of eating disorders. Now then, both groups had higher than expected levels of eating disorders.
Yes. Anxiety
you
and
might
OCD both had higher
slightly
rates
higher,
of eating
but that may
disorders.
not be real because we're talking about a clinical population, and
That
if you've
are
got a
in
clinic,
treatment already.
and
Okay.
if you've got they've come to treatment, and so for them to be
Yes.
recognised, they may have slightly
Then
more
mine
severe.
is not the same as the general population that is not seeking help.
But actually, what we found was that the people with anxiety disorders had a higher rate of eating disorders than those with
With
OCD.
Okay.
And I think there's, if you ask me personally, and I can't really give you the research data from that, but from my clinical experience, I would say that if somebody has anorexia and they are starving, people that are starving often exhibit obsessions and compulsions.
Well, that
And that
wouldn't be
as
the
you
underlying-
refeed them,
yes.
they may, as they get back towards a normal weight, they may that may disappear.
Okay.
The other thing is that OCD often occurs with people with autism and other neurodevelopmental
Yes.
disorders. The same is true with people with anorexia, particularly. Anorexia is often perfection seeking as you get in.
Yes.
And so there's huge overlap. And all of these conditions, I could draw, if you like, a Venn diagram with them all overlapping. And as we look at the psychology more of these disorders, we used to think that compulsivity and impulsivity were opposites.
Okay. Yes. Yes.
So compulsive is what kind of thing I've been describing.
Yes.
It's being risk averse,
Yes.
avoiding risk, trying to put it right,
And trying to control.
trying to control. On the other hand, there's impulsivity, which you always think about people that have uncontrollable gambling, drug addiction,
Right.
alcohol, etc. But actually, OCD sits in between these.
Oh,
And
that's
you get
really
some
interesting.
people with OCD that have more of the impulsivity, and then the people with low impulsivity and higher compulsivity are more towards the risk-averse anxiety.
Okay.
So it spans across. So you do get people with OCD that have impulsive behaviours as
Right.
well.
As you clearly described in the book, it's a continuum.
Yeah.
So there's not one description fits all for OCD. There's different
yeah, I think with OCD,
rates and manifestations.
I think with OCD, I would always say, rather than OCD is not a trait or a quirk. So you've got to have these horrible thoughts, images, impulses coming into your mind, causing you to do something, and it's got to interfere with your life. I would I think
what
that's the
people
key
have
thing.
to- yes.
And if you say, are experiences that people with OCD have completely alien to the rest of humanity? Of course not. The same's true of any psychiatric,
Of course.
psychological condition. You know, everything, if you like, could be considered a spectrum. But I think that doesn't mean that everybody's a bit OCD.
Oh, okay.
What it means, I wouldn't
Perfect.
say.
I
I
agree.
would say everybody's human. And if you have OCD and it's interfering with your life, then you need to have
To seek
help.
attention,
If it's not interfering with your
Yes.
life,
Don't
then
call it OCD,
don't-
please.
Don't call it OCD,
Yes.
and don't worry about
It's
it.
like my best friend. She's very tidy, but in a very functional way. And she says, my OCD, I always like my house to be
Yeah.
very nice and tidy. That's not OCD.
No,
because
that's right.
It's actually supporting her life. You mentioned a pilot, a plane pilot, or a doctor. He is very, I don't want to use the word obsessive, but if he's very
Meticulous.
and very disciplined, that's not OCD. That's, that is
Was it
a good job, an ability to perform.
many, many, many years ago? A friend of mine did a little study when they looked at people that had OCD and had recovered.
Yes.
And they got a control group, which was a group of medical students.
Yes.
And when they looked at their compulsive behaviours or the medical students were higher. But it wasn't interfering with their life.
Of course.
Well, one or two, you would expect it would be. They would have clinical OCD. But in the main, it wasn't. And if you think about it, if you're prepared to go through school, get all your exams, spend 5 years at university, then go into what can be a 10, 11-year postgraduate specialty training, and you've got
you gotta love it.
And you've got people's lives.
Right.
You're going to be, shall I say, dare I say, we're all a bit odd, and we're going to have our own. You're not probably going to be average in how you approach life. I don't think you necessarily need to be very clever, but I think you need to be to throw yourself into it. So I think that's the answer. So I always say, if it's not broken, don't fix it.
Exactly. So there's one more thing I would love to talk about a little bit more is, as you explained it, and I was as I was listening to you, and then I add up all these more spiritual or spiritual understanding, or maybe the underlying. Would it be that we don't feel in control of anything, and that's the source of many of those behaviors? Do you find control as something that many people with OCD need, or not really?
I don't really think so. When you say spiritual, that reminds me, the one type of OCD I didn't mention were people that have, religious people that will have blasphemous thoughts.
Oh, okay. And they would punish themselves.
Really worry. And so then they will pray excessively.
Yes.
And usually, whichever religion, be that a Christian religion, a Muslim religion, a Hindu religion, Buddhist, you name it.
Yeah.
I like at that point when they say, "Oh, I need to do this," we say, "Well, shall we get the local priest, imam,
come over
and let's have a discussion," and they will recognise that this is abnormal and it's out of this. So when you come to what causes OCD, I think there's absolutely no doubt that there's a high genetic loading.
Okay.
It runs in families.
Okay.
And that's for sure. When it comes to other things, I think all of us have a level of protection, of resilience.
Yes.
And I think resilience also runs in families.
Yes.
But I also think that your early upbringing may help to boost that resilience.
Yes,
and
of course.
There's some evidence that if you're loved and cared for, you release oxytocin, and that can block some genes.
Yes.
But I don't want to go to parents, particularly mothers, always being blamed for, because that is rubbish.
Yes.
And it's not true. And I think that that's just a small part. I think a lot of it is innate.
Okay.
Now then, if you're...
So it's not really some experience or some perception of what you're living that detonates.
No, I think, you've got resilience and you've got a tendency. Now then, some people will be so loaded towards OCD that if they had the most perfect childhood and everything is wonderful, they'd still get OCD.
Of course, I get it. Yeah.
Other people need some kind of event that will trigger it.
Okay.
And all of us, if we have horrible things, enough horrible things, are going to break down in one way or another.
Mm-hmm.
What resilience does is makes it less likely that you'll break down as quickly. But given enough trauma, you will break down.
Of course.
So I think that we've got genetics, we've got life events. sometimes these life events aren't things that we think of as classical trauma, but they have come across as that. Then there may be other factors. And I said it's controversial,
of course.
But there is a belief that certain infections in childhood may cause OCD in a small component of children. And that can manifest in OCD. So I think that if we were to come back 10, 15 years down the line, maybe we wouldn't be talking about OCD. Maybe we'd be talking about the OCDs, or maybe we'd give them different names.
Okay.
Because what we're talking about is the end result, the syndrome, the collection of symptoms. But there may be lots of different ways to arrive there.
Yes.
And I've mentioned some of them with autism, neurodevelopmental, but then there's the genetics, then there's the life events, then there's even possibly infections.
Of course.
And autoimmunity.
Yes, that is so interesting, because then it's completely out of the question, or let me rephrase it, the judgment that this is a character flaw.
No.
It's completely out of the question. It is not something that you did just to be annoying.
You know.
No? You suffer so much.
Absolutely.
Yeah.
I've worked in the area of OCD for 40 years.
Yes.
And some of the bravest, most wonderful people I have met in my life have OCD.
Yes.
They are amazing people. Not everybody.
Of course.
But an awful lot of them. And very often they're very kind, because they're trying to prevent something awful happening to you and I, even though they know it's not realistic in that way. So, no, these are not these are not flawed people. These are lovely people in the main.
What have they taught you for your own life that you have maybe helped you grow more or become more aware of something in your life?
Oh, goodness, it's been such a long time I've been working in this area.
They
but I
shape
think
you,
there's
of
so
course.
many things that my patients have taught me. They have taught me that you can't be brave unless you experience fear. And because treatment means facing up to your fear, my patients are heroes.
Of course.
You know, it may be that just because I'm asking people to touch a toilet seat, you might say, well, that's not that bad. But to that individual,
that is their demon, their dragon.
It's the worst thing. So I think they've taught me with their bravery. I think they've taught me with their patience, because their ability to withstand the knocks, because it's often very difficult to get the right treatment.
Yes.
And they've also taught me humour. I have a wonderful patient who has done some podcasts, and so I can say his name, Dominic, or Dom, and he was talking the other day about when he was in my treatment unit, and all the patients would go out on a Thursday night to a local public house, a bar, and they would do the quiz. They have quizzes, and he said they'd all be sitting there. They wouldn't drink alcohol, because that is one of the rules of the treatment service. But he said there would be somebody that would be spending an hour trying to sit down because they were worried about sitting down in the right way. There would be somebody else under the table checking they hadn't dropped something. There would be, and he said at the end of the day, they were all on the way home, when it took them so long to leave the thing, they were all laughing at each other and poking fun in a loving way.
Yes.
Not because they were all in the boat together. And I think that's amazing that these, you can have this, but yet you can see the absurdity.
Yes.
So, yeah, I think that people with OCD are amongst the nicest people I know.
Lovely. And just tell us a little bit more about, you said, if you suspect you have OCD or if you think someone you know might be having OCD, the key is it's a behavior that is disturbing their life. It's
got to interfere with their
interfering
life.
Their
if it's
life.
Not interfering with your life, don't worry about it.
Okay. And then there's treatment. There's many treatment options, and you also mentioned that...
Well, there's two main treatment options.
Two main treatment options, yes.
One is medication.
Yes.
And those are serotonin reuptake inhibiting medications. They need to be given at a higher dose than you need for depression.
Okay.
And they need to be continued for longer. So whereas with depression you may see improvement in a week, with OCD it may take 2 months.
Okay.
And if at the higher dose there's no improvement of 2 months on one, it's worth switching to another.
Okay.
That I mention that first because that is the cheapest option, if you like, that can be applied. And we know that to each attempt, about 60% of people will show improvement with almost a half reduction in symptoms. Then there's psychological treatment. Now, there are varieties in psychological treatment, but the key thing is always in a gradual, controlled way, facing up to things that you fear without putting it right.
That's why you mentioned touching the toilet seat, for example.
Yes. But you wouldn't do that on day one. And what it needs to be is baby steps, starting with things that cause a little bit of anxiety, but not too bad. And doing that, I always say 3 times a day after meals. And people say, why after meals, doctor? And I say, I don't know, but doctors always tell you to do things after meals. But the idea is to do it and to do it for long enough. It must be 2 hours without giving in to the rituals until the anxiety comes down. And once
it's like desensitizing, maybe a little bit.
Yes. I don't like that word because there is a treatment that was meant first called systematic desensitization, where people don't experience anxiety, and it's a bit different. Okay. So I would say ERP, or exposure and response prevention.
So it might instead of desensitizing, it's like you do it and nothing happens.
And you keep going, and your anxiety will come down. That's called habituation in English. And then once you've mastered those things, you move on to a more difficult one, and you master that, and you move on. So this is not a sprint.
Of course.
It's a marathon.
Right.
And
even with the longer training that a marathon requires. I mean, it's not something...
But it doesn't matter at the end of the day if you get better. That's the important thing, is getting better.
Yes.
Now then, there are other things that you can add in, but let's be frank about it. There's a shortage of therapists.
Yes.
And people aren't getting the treatment they need.
And there's no information, so they might be misdiagnosed and mistreated.
Absolutely. Yes. So you might come along and decide you're going to spend a long time looking at cognitions and doing other things as well. Mm-hmm. Because the important keystone is this exposure. Well, that's lovely. But if you've got a shortage of therapists, we know that exposure and response prevention is easy to learn, easy to apply, and is relatively quicker. And when you look at the research, there's no difference whether you do more as long as you've got the exposure.
This is the core.
So my argument would be, and some would disagree with me, I would go for exposure and response prevention, ERP, first and foremost. And then if you, along the line, with that small number that don't get better with that, then take a step back, assess why that is, and look at other ways of maybe helping out. So I would say that first-line treatments are the medication I've mentioned and or exposure and response prevention. And there's a lack of therapists, and that's really the motivation behind writing the book, to give everybody the information.
Yes.
And maybe some people can start doing it themselves. It's not easy, particularly if you've got moderate to severe OCD. You may need somebody to encourage you.
Yes.
But if it milder symptoms, I'm hoping people may be able to overcome it that way. And of course, there are self-help groups out there.
Yes.
And I know there are some excellent self-help groups in Mexico.
Yes.
And maybe a book and support could be what some people need when professional help isn't widely available.
Even just to learn about it and maybe get an earlier diagnosis than 20 years.
Yeah. Oh, absolutely.
No?
I think that's really important. And that's why I've done a lot of television, radio, magazines and things, and talked to groups of general public for so many years, because there's no point telling the people in authority. They won't change unless people start demanding it.
Exactly.
And so if you've got a condition, I think what you need to do is to know all about it if you can. And then you're armed with the information, and you can say, you can try and
you can be
get
your own advocate.
Yes.
Yes. Thank you, Lynne. It was such a wonderful conversation. Thank you for the book. We're so happy that it's in Spanish, and all this can reach a wider, it can be a wider net, and more people can find the support they need to overcome.
Thank you so much for inviting me. Lovely to talk to you. And I do hope that people in Mexico will get more treatment now, and hopefully that they deserve.
Don't forget, there's light at the end of the tunnel.
That's right. Always light at the end of the tunnel. No matter how long you've had the problem. I've seen people that have had it for 40 years and have got better.
Lovely. Thank you so much. So maybe you have a social media. The book is available in Gandhi, in Sanborn's, all bookstores, Amazon, all digital bookstores as well. And in Spanish is Talk, Todo Lo Que Tienes Que Saber, por la doctora Lynne M. Drummond y Laura J. Edwards. Thank you so much.
Thank you.
Talento para la vida con Lourdes Botello.
Esta es una producción de Marta de Baile.